As we age past 50, our bodies face increasing challenges. Chronic inflammation creeps in, raising risks for heart disease, joint pain, and even cognitive decline. According to the National Institutes of Health, nearly 40% of adults over 65 deal with cardiovascular issues, often linked to high triglycerides and blood pressure. Mental fog and mood dips become common too, with studies showing up to 20% of seniors experiencing mild depression. But here's where EPA shines. It's not just another supplement. It's a key player in fighting these age-related battles at the cellular level. EPA, or eicosapentaenoic acid, is a long-chain omega-3 fatty acid found mainly in fatty fish like salmon and sardines. Our bodies can't make much of it on their own, converting less than 15% from plant sources like flax seeds. That's why direct intake matters. Research from the Office of Dietary Supplements highlights how EPA competes with inflammatory omega-6 fats, producing milder eicosanoids that calm the body's response. This shift can lower overall inflammation, a root cause of many senior health woes. Now, let's talk about the first under-discussed benefit: EPA's superior protection for your heart. Doctors often recommend general omega-3 supplements, but studies show pure EPA outperforms mixed formulas with DHA in the REDUCE-IT trial, published in the New England Journal of Medicine in 2019. Over 8,000 adults aged 45 and up with heart risks took 4 grams of pure EPA daily. The results? A 25% drop in major cardiovascular events, including a 20% reduction in heart deaths and 31% fewer heart attacks. Unlike trials with combined EPA and DHA, which showed inconsistent benefits, pure EPA slashed risks dramatically. If you're over 50 with high triglycerides, this could be a game changer. Always consult your doctor before starting. Moving to brain health, another area where doctors might not emphasize EPA enough. As we hit our 50s and beyond, brain volume shrinks, affecting memory and focus. A 2023 study in the journal Brain Sciences examined 40 healthy seniors around age 76. Those with higher blood EPA levels showed better delayed recall and processing speed on cognitive tests. Even more striking, EPA correlated with larger volumes in the entorhinal cortex and white matter, key areas for memory and nerve signaling. The Rotterdam study, following over 5,000 adults aged 55 and up, found that higher EPA intake from fish reduced dementia risk by up to 60%. This suggests EPA helps preserve brain structure, potentially warding off age-related decline without the fanfare it deserves. Inflammation control is EPA's third hidden strength, especially for joints and overall vitality. Chronic inflammation fuels arthritis and fatigue in seniors, but EPA steps in by blocking potent inflammatory pathways. A meta-analysis in the Egyptian Journal of Internal Medicine reviewed trials where EPA reduced markers like C-reactive protein by up to 30%. For rheumatoid arthritis, common in those over 50, doses of 2 grams daily eased pain and cut NSAIDs. In hemodialysis, patients soften older adults 1.8 grams of EPA over 2 years slashed cardiovascular deaths by 80% per a 2013 study. This anti-inflammatory edge extends to everyday aches, making EPA a quiet ally for active aging. Don't overlook EPA's role in mental well-being, a benefit doctors sometimes skip in routine checkups. Depression affects 1 in 5 seniors, but omega-3s, south-like EPA, offer hope. A 2016 meta-analysis of 26 studies found that higher EPA intake lowered depression risk by 17%. EPA influences brain eicosanoids, modulating mood-regulating pathways. In older adults with mild symptoms, formulations rich in EPA improved emotional stability, as noted in Cochrane reviews. Combined with its brain protective effects, this makes EPA a multifaceted tool for mental resilience after 50. Finally, EPA supports eye health, an often ignored perk for aging eyes. Dry eye syndrome hits 14% of U.S. adults, rising in seniors, while age-related macular degeneration threatens vision. The Women's Health Study, tracking over 32,000 women aged 45 to 84, linked higher omega-3 intake, including EPA, to a 17% lower dry eye risk. Though mixed, trials like ARREST to suggest EPA may slow AMD progression by reducing retinal inflammation. For seniors relying on clear vision for independence, this is a subtle yet vital advantage. To incorporate EPA effectively, start with these actionable tips. First, aim for 2 to 3 servings of fatty fish. Weekly think 3 ounces of salmon, providing about 0.6 grams of EPA. Second, consider a pure EPA supplement if fish isn't your thing. Look for eicosapent ethyl, starting at 500 milligrams daily. But check with your physician for interactions with blood thinners. Third, pair it with a balanced meal for better absorption. Studies show moderate fat enhances uptake by 20%. Fourth, track your levels. Aim for an omega-3 index above 8%, as higher correlates with the brain and heart benefits we discussed. Let's recap. EPA isn't just for heart health, it's a powerhouse for reducing inflammation, sharpening cognition, lifting mood, and protecting eyes. Backed by trials like REDUCE-IT and the Rotterdam study, its pure form offers advantages doctors might not always highlight over generic omega-3 south. By age 50 and beyond, prioritizing EPA could mean fewer risks and more vitality. If this resonated with you, subscribe now for weekly insights on senior wellness. Hit the bell for notifications and comment below. Which EPA tip will you try tonight? More fish, a supplement, or something else? Remember, always consult your healthcare provider before changes. Thanks for watching, and take care of your health.